Welcome, everyone. Welcome to today's podcast on POA indicators for inpatient coders. Now, coders, you know that code assignment is really important in coding, but there's also a thing called POA indicators that we have to assign as well. POA stands for present on admission, and basically these indicators tell us whether or not a condition or a diagnosis was present when the patient was admitted to the facility. So a present on admission indicator is dependent on each diagnosis the patient has during their stay. And there are 5 main indicators. So the first one is a Y, which stands for yes, the condition was present on admission. The next one is N, which means no, the condition or the diagnosis was not present on admission. And the other ones, which are less frequently used, there's a U for clinically undetermined, which means basically that the doctor did not have enough information to be able to determine whether it was present before or after admission. Then there's a W, which means insufficient documentation. So it's not the physician telling us essentially that there's not enough information, but it's not documented in the medical records. So as we know, if it's not documented, we can't code it. So that's what the indicator W is for. And the last one is a 1, the numeral 1. And that means that the code or the condition or the diagnosis is exempt from POA reporting. So on that one, it just means we don't need to capture that POA indicator, so use a 1. These are super important in inpatient coding because if the indicator is an N or no, that says that the patient didn't walk in the door with the condition that they have been diagnosed with. And so that in turn becomes what we call a HAC or a hospital-acquired condition, which indicates poor quality of care. So the more HACs that a hospital gets on their record, the more challenging it is for them to pass accreditation and other things. Their HACs are closely tracked by not only the hospital themselves, but the Joint Commission, accreditors, and even Office of Inspector General. So thank you. And if you have any questions, please email me or call me. Thanks.